Hi, everyone, and welcome to the webinar, Surface Selection and its Impact on Health and Wellbeing, sponsored by Hyundai LNC USA. I'm Ann DiNardo, Executive Editor of Healthcare Design Magazine, and I'll be your moderator for today's event. Now, before we get started, I'll run through a few housekeeping items. First, this webinar is broadcast over the internet, so you'll want to make sure that your computer audio is on and unmuted. If you're still having trouble hearing us, please look for the question mark in the upper right corner of the webinar interface and select Test My System Now to see if you're having connection issues. You may simply need to disconnect and rejoin the event to fix any problems. Technical questions can also be asked during the event by using the Ask a Question field on the left side of your screen. Our webinar producer will answer those as quickly as possible. You'll also use that field to insert questions for our presenter, and we'll do our best to address those during a Q&A before we wrap up. And finally, this event is being recorded to provide on-demand viewing later. You can access that recording through your registration link beginning about 15 minutes after we conclude today. And now I'd like to introduce our presenter. Linda Liebert is President and Health Surface Safety Expert at Healthcare Surfacing Consulting, LLC. Linda, thanks for being here today, and I'll go ahead and hand things off to you now.
Okay, thank you. Thank you, Ann, and welcome everyone. I'm going to go through just a few more slides quickly because this webinar does qualify for CEU credit, and so you'll work directly with Hyundai to access and for credits. So our learning objectives for today is to gain clarity of the science of surfaces and how they support microbial acquisition and transmission. We're going to learn about how to implement the 7 aspects of surface selection to develop an effective evaluation process for surface materials and products and their selection. We're going to empower architects and designers and facility directors to minimize risk using surfaces to support infection prevention protocol and guidelines. And ultimately, we're going to create a healing environment with the use of solid surface and quartz. And we will talk today about specific case studies that I've worked with in the past to solve problems. So we are all more than familiar with coronavirus. This novel virus has emerged, and for a while we believed that it was being transmitted via surfaces. We now know that it is being transmitted by aerosolized droplets. However, what has not been researched, and further research is needed, is the fact that anything that is aerosolized eventually lands on surfaces. We do know that coronavirus can survive on surfaces for up to 9 days. And research has shown us that we have found it on walls, we've found it on countertops, we've found it on door handles. So we can't just walk away from the issue of surfaces and how they can actually contribute to the spread of the coronavirus. But it's also opened the door for us to talk even further about more issues and other microbes that exist in our environment. The Healthcare Surfaces Institute had one of our experts, Dr. Saeed Sattar, put together a video or a webinar program that really talks about survival and inactivation of viruses on high-touch environmental services. And I highly recommend going to the Institute website and viewing that webinar to learn more about how coronavirus actually lives and survives on surfaces and how it can be transmitted. Surface safety is the top of everyone's mind. Of course, we're concerned when we're in public spaces, but today what I want to do is focus on healthcare. That is where we've got immune compromised patients and healthcare workers that are always at risk. But beyond COVID, there are other HAIs. And what's been interesting about healthcare recently is that while we have focused on COVID, what's happening is our HAIs are increasing in the healthcare setting. And let's talk a little bit about the numbers. So it's easy to say 99,000 people approximately die every year. That's a CDC number. And 1.7 million people will acquire at least one infection. But let's talk a little bit more about more graphic to give you a better idea of what is 99,000. Imagine one airplane crashing every single day, killing everyone on board. That is how many people die from hospital-acquired infections every year. Now, we know that would never happen because the first plane would crash, and we have all kinds of professionals that begin to evaluate all aspects of the problem. Why did it crash? What were the components? We look at absolutely everything. Unfortunately, this isn't happening with hospital-acquired infections. 1 out of every 25 patients that are being treated in a healthcare setting will acquire at least one hospital-acquired infection. 1.7 million people have been affected by this. And when I say affected, either they've had a family member or they themselves have been infected, and it's life-altering in many situations. Sometimes people never fully recover from that hospital-acquired infection. It can be devastating. The World Health Organization estimates that by the year 2050, hospital-acquired infections and antibiotic-resistant microbes will be the #1 killer in our world. So it's really critical we address this problem. This document here we can actually provide. This is just a very, very minimal amount of research that currently exists that shows surfaces support the acquisition and transmission of microbes that cause the deadly infections. And again, we're happy to provide this for you if you'd like to do deeper dive. One of our biggest problems is we are addressing a microbial issue at a macro level. Microbes can't be seen. And a lot of times when we go to clean an environment or to address, do a room turnover or things like that, we make an assessment on whether or not the surfaces of the room are clean based on our visual evaluation of the area. If microbes could be seen, this is what they look like. They're beautiful. They're a variety of colors. However, we can't see them. So there's some things we need to do to get deeper into this issue. There are many different types of materials and textiles that are used in a healthcare setting, or in any setting for that matter. It can be anywhere from, vinyls. I've got a few things pictured here. We've got textiles, we've got solid surface material, we've got laminates, and we've got tiles. But it goes even further beyond that. And that becomes one of the areas of concern. Surfaces are fomites, and what a fomite is it's referred to an inanimate object that can carry and spread disease and infectious agents. They're also called passive vectors. And so an example of that here, and I've used stainless steel, not because I'm criticizing stainless steel, but to point an issue out, brushed stainless steel already has tiny microbial reservoirs created when the material becomes brushed. And if you look at the manufacturer instructions for cleaning and disinfection, it's very, very clear to telling people that you need to clean and scrub in the direction of the grooves or the brushed material, because that's the only way you're going to be able to actually clean or disinfect microbes out of those areas. The same is true for the pebbled stainless steel, which you see on the right. And, we talk a little bit about categories of materials: stainless steel, textiles, durable coated fabrics, solid surface. There are laminates. There are many, many different types of laminates, solid surfaces, etc. So questions really need to be asked, and a real good evaluation needs to take place. So let's talk a little bit about the microbial world. This photograph is a picture of E. coli. Now, the E. coli has attached itself to a rough surface. So the rods are the E. coli, But the netting material that is around that is biofilm that the micro excretes itself to protect it from being cleaned off. And so a lot of times with microbes, when a biofilm is formed, it becomes very difficult for that surface to be cleaned and disinfected, and often requires scrubbing in order to actually remove the pathogen. The next problem we encounter after we have microbes that have adhered to a surface is understanding how people are interacting with the surface materials and how you need to clean the materials. So I have a story here. I was an advocate for a patient, and I was in her room. This is a photograph. The bottom one is actually a photograph of her room. She was a non-ambulatory, so she was in her bed. And the area around a patient bed within 3 feet is considered a hot zone. We all offload many millions of microbes all the time. And so within 3 feet, when you've got a non-ambulatory patient, the bacteria and the microbes are being shed. And so this area becomes highly contaminated if it's not cleaned and disinfected. The reason I'm telling this story is this area is just off of the foot of her bed. And you can see here multiple materials, solid surface, and it's a windowsill, by the way. Solid surface is the windowsill. And then you have drywall, and then underneath that, you've got a acrylic wall surface that has a pebble texture. You also have batten strips that then matches up with a rubber baseboard that then matches up with a laminate floor. So you've got a lot of different surface materials in this area. All of them are required to be cleaned differently. And this is something we don't often realize when we're specifying materials. So this area often is not thought of as critical. And let me tell you how this area is used. So first off, the patient, a nursing assistant came in to empty a cath bag. Unfortunately, it spilled and it splashed up on this wall. That nursing assistant took a dry rag, wiped the wall off, and let it go. And it never was cleaned again. This is an area, the solid surface windowsill, where they put clean linens, dirty linens, and visitors used it to sit on. And when the visitors sat on that windowsill, their legs draped onto that wall, which was contaminated. And before those visitors left, they went over and sat down on the patient bed. This is how microbial transmission begins and starts to happen. This is an example of the many different surface materials. So I refer to them as assemblies. There are many materials that are assembled onto one product or in a room. And in this case, this is an ultrasound probe. So when you go to clean and disinfect this probe, what has happened is damage has occurred due to chemical exposure. And you can see what happens. Those areas are very difficult to clean, if not impossible. And we've created a microbial reservoir that is not cleaned often enough. So today what I want you to do is look beyond a product and start to see the number of materials that are on any given product or in a room. And this is an emergency department, high turnover, high contamination, and the room is also, because it's set up for multiple patients, you not only have the materials that are within, on the bed or gurney, for instance, all of the materials that are applied to that back wall where it's mostly used for life safety, so suction, air, so on and so forth. But I really want you to notice that on any one product, for instance, that gurney, there are multiple surface materials. And by the way, gurneys and beds are one of the most highly contaminated area in a healthcare setting. And I also want you to notice in the background. So if you brought multiple patients into this room, all of those materials, medical devices, et cetera, that you see sort of in that second patient bay, all of those can become contaminated as well. The difficult part here is this room is turned over rapidly, and all of those materials need to be cleaned and disinfected differently. that never happens, by the way. There are specific infection prevention guidelines that are followed. Real life happens. So when we design different areas of a healthcare facility, oftentimes we have not been able to understand what truly happens during patient care. So I've used an example of at the top on the right this is the aftermath of a trauma that took place in this emergency department. And you can see there the photograph, some of the graphic, the blood on the ground, body fluids, etc. But I also want you to notice the wall behind it, the medical device where the blood is actually spattered. So what people often don't understand is, number one, floors are one of the most contaminated areas in a hospital and help spread infections. So what also happens is that due to the Accountable Care Act, based on the amount of time that the hospital is required to admit or discharge patients, the ability to clean and disinfect a room, or the time that is allotted, is also often very minimal. And so in this case, this room needed to be turned over and prepared. Turned over, it means disinfected and prepared for the next patient. They're given approximately 20 minutes to 45 minutes in a really bad situation to turn that room over. That means they will turn this room over using the disinfectants that they have on their cart, and they will turn it over quickly. Starting to kind of get an idea of how nearly impossible it is. There are over 41 different instructions for use and care and maintenance requirements for just that small area that you're seeing. The bottom photograph I used just to kind of give you an idea of how microbes spread via floors. You can see the body fluids on the floor in that area. Nurses, patients, gurneys, medical devices, everything rolls through there. And I am aware of infections that have been transmitted via carts and gurneys throughout an entire hospital. So let's talk about 7 aspects of surface selection. And this is taking all aspects of a potential problem and putting it into a simple form or a format that you can use to evaluate the selection of surfaces. So location. Is it a high contaminated, high turnover, frequently cleaned, immune compromised area, for instance? Emergency departments, operating rooms, bone marrow transplant areas, those are considered high contamination, and they are cleaned frequently. It's not unusual for a given surface material to be cleaned 14, 15 times in a day. And you want to make sure that when you're selecting the materials, those materials can withstand that type of cleaning. Microbiology. When we talk about microbiology, again, emergency departments, a lot of different things are coming in and out. And depending upon the microbes, it requires different types of cleaning or disinfectants. The materials and textiles. Can a room be turned over quickly? Will the materials and textiles be able to withstand the infection prevention guidelines that are presented or required to be followed in a healthcare setting? Assemblies. Multiple materials are combined in one room or on any product. So evaluating the assembly, the individual materials. You know, I always say that truly cleaning and disinfection or infection prevention begins at design. And it's the ability to actually be effective in cleaning and disinfecting materials. And just as I said, cleaning and disinfection. You want to also understand what are the processes and the products that are being used. There are hundreds of disinfectants, so you will never be able to test or evaluate all of those. But you can evaluate categories of disinfectants when you talk to your distributor or your material representative. Manufacturer warnings. Don't stop at the IFU. Ask them what materials will not withstand medical cleaning and disinfection or medical disinfection and sterilants. An example of this is stainless steel. Most people don't realize that bleach is very caustic to stainless steel. And the first instinct, you know, I had an infection preventionist say once, well, what do we do? Just go to all stainless steel? And my response was no. that doesn't work everywhere. And if you're cleaning it frequently and you're using any type of bleach, you could be damaging those surfaces. And then finally, human behavior, which we just talked about. How many surfaces, what are the surfaces that people interact with most frequently? So I want to talk specifically today about solid surface solutions that can support and be solutions for infection prevention processes and protocol. And so there are many different solid surfaces. And there are also many definitions for non-porous materials or solid surfaces. So today, what we're using as a definition is it's a non-porous manufactured product. It's made of polyester, acrylic, or a combination of both. It comes in sheets or can be cast and poured into a shape or molded, and can be repaired, reused, and is seamless. It is never porous. So for instance, one of the things that is recognized as a non-porous product would be wood. Well, one of the claims is made because the resin that is used on the wood prevents moisture from breaking through that barrier. However, based on the way it is cleaned and disinfected, eventually that resin material or resin coating will be gone. And that then creates you then have a non-porous, you have a porous material. So it's really careful when you evaluate. Same is true with durable coated fabrics. The claim is that it's non-porous. It is moisture resistant, but again, it goes back to the resin that is used on the top of it. Today, as we talk about solid surface, it never becomes porous. It's easy to clean, easy to disinfect. Most disinfectants, hospital-grade disinfectants, can be used with little to no effect. But if there's ever any effect, the solid surface material can be repaired. So the longevity and life cycle exists. You want to make sure that when you're talking to your solid surface manufacturers, you look at and discuss the testing data that they have. There are 7 categories of EPA-registered hospital-grade disinfectants, and they're categories. So it's not the proprietary products that a disinfectant company will sell and that are used in hospitals, but they're categories that provides the information to a healthcare facility or you as designers and architects. It provides you with adequate information to say, you know what, they would be able to clean and disinfect this product. You also want to be sure that it will withstand UV and hydrogen peroxide cleaning. Many times after a manual cleaning, a healthcare facility will use a UV product, being a robot or lights. There's so many different kinds. There is a new product out that is a durable wall surface material, but there is a manufacturing warning that says do not use UV. This is not a product you want to specify into an area that would potentially have UV. And always refer to care and maintenance. I spoke to a group of specifiers, and one of the questions that I asked them is, how many of you review care and maintenance and manufacturer warnings? It was really scary to find out that over 85% had never even looked at any of the care and maintenance or cleaning or warnings at all. So this is really critical that we, that be evaluated. So solid surface differences. Resin is used in solid surface materials. So all of them have ATH, which is aluminum trihydrate. There are polyester acrylic blends. And there are some materials that have also embedded, for instance, antimicrobial reagents or materials into their solid surface. So there are many different kinds. You want to make sure you're always asking, is this, what are these? You will find that all of them have a different level of durability and should be used in a variety of different ways based on what they're made of. So polyester it can be very, very brittle and break. It's beautiful because you see particulates and it backlights really well, some of those types of, but it can be easily break and crack. you're better off with an acrylic, and then you've got acrylic polyester blend. And the reason they blend those is because it adds more strength and durability. They can be repaired and replaced, and in some cases reused. So you can actually reconfigure solid surface into a different shape or into a different area of the hospital. It's incredible. So you get a longer life cycle and disposable, you don't have to dispose of it. It is non-porous and it's easy to clean. Real life challenges. These are the case studies. So the first one, all of these are around the same hospital, by the way. It is a 912 bed teaching and research hospital. It's high traffic, highly contaminated because they take in all patients, including a lot of homeless people. And so this is the first photograph is going to be of the emergency room and their problems. So when we ask them, what are the issues? What can we help you? What problems can we help you solve? So the difficulty is meeting room turnover times. Cleaning and disinfection effectiveness between patients was very difficult for them to deal with. Damage to the walls, again, ER, so fast-moving equipment, material, gurneys, equipment running into the walls, etc. The previous walls were drywall and paint, and they had utilized rubber baseboards. The chair rail, they had a chair rail in there that was for a bumper guard, but it didn't necessarily solve the problem. And they had issues with cracking and breaking. And anytime anything like that happens in a room, they need to repair it quickly because it becomes just infection prevention issue. What did we do? Number one, we went floor to ceiling. This is, again, an emergency department. We went floor to ceiling with a solid surface material. The material on the wall coved into the floor, so we eliminated the rubberized baseboard in the room, which was a cleaning nightmare. There was a connection point between the floor, it was not solid surface, but the floor and the coved base, but it's easier to clean that with a mop as opposed to having, the top of the baseboard and the bottom of the baseboard both to clean. The color change, or the band that you see there, was designed as a high touch area. So in the event of multiple casualties, this was an area that they designated as high touch. And so the environmental services professionals knew that was an area that needed to be cleaned and disinfected. And again, solid surface was compatible with most all of the disinfectants that were being used in that area. So the photographs on the right, same patient. This is one of the ER bays. The sink area, their issues were, again, room turnover time, but water damage to the walls. This is what was different because people are constantly washing their hands in this area. And so the paper towel holder and the soap dispenser, when people get their hands wet, what they do is reach up to that area and water would drip down the back wall. The solution for that was to go from ceiling to floor and integrate everything. So this is actually the sink, the wall. You can see underneath the sink where the base bar, the cove went into the floor. We literally created an area for them that they could just wipe clean or easily get clean. Okay, sorry. So on the bottom, the reason I put this photograph in is that the architects and designers specified the right material. But what they didn't understand is not all fabricators were capable of being able to actually work with the materials to create what we wanted, which was non-porous and coved in space. So I wanted to show you an example of what can happen when the design requirements are specified properly. However, the low bidder in this project won, and we ended up with a nightmare. So we actually did go in and redo all of this space. And again, pointing out the color. The green color was a high touch, and they needed to, that was required for cleaning. Another photograph, this is the outside. So this is a hand washing station right outside of these bays, these emergency room bays. And so the situation that was created here with design was the multiple surface material. The top photograph shows a vinyl wall covering on the top, a ridge, and actually on the left-hand side where you can see the sink backsplash that comes up to a certain level, there's also another material behind that. So, two additional edges. So the solution here would have been to be able to take it up underneath the paper towel dispenser, but also to create a seamless wall so they weren't cleaning different material types and textures in that one area. And on the bottom two photographs, I've just added some arrows to point out where some of the areas of concern are. If you design this, you can actually design it where it can easily be wiped down, cleaned off, and disinfected. But when there's multiple material types, or an assembly is what I call that, you now have to clean all of those things differently. So your ability to clean quickly is inhibited. This is a patient bathroom. This was a renovation or a remodel area that we did in a med-surg. And on the lower right-hand corner is the sink and wall, et cetera, in this patient room originally. What we did is we replaced it with solid surface. Again, so the one on the left is another one of the patient rooms. We actually took solid surface from the ceiling to the floor and again addressed the water issue. And so that's an example. Again, much easier to clean that area outside of tiles, which you have to clean individually, and all that grout and the tile material actually requires two different types of cleaning, which will never happen. So that was how we solved that problem. Another thing we addressed were walls. High traffic areas, wall damage. In the photograph on the left-hand side, what you can see is a cart wash area in their food service. That wall, that white wall, was actually brick, cement brick that they painted with a moisture-resistant paint. What we did is used a solid surface material that could easily be repaired. They were having to replace and repair this area frequently because cement block is actually porous. So they were covering it with paint. They had to repaint it frequently. We used solid surface in this area. And easy to repair. They would be able to roll their carts in, hose them down, easy to clean on a daily basis. And the center picture is in a high traffic hallway. It's actually in an entrance and not necessarily planned to be a wheelchair bay, but we had to deal with wall damage. And so we put solid surface there. And then the same with the food service cart area. If you look at how that food service cart is lined up with the wall, you can kind of see what areas were being damaged. And so this completely solved that problem. Yes, it was nicked periodically, but again, you can easily repair the solid surface material. But you've also addressed a cleanability issue. Solid surface can create a very warm and welcoming environment. You can combine solid surface material with other materials, as you can see in these reception areas here. And the possibilities are unlimited with solid surface. Now, this is not a hospital, but it really shows you all of the escalators. That is solid surface on the outside, easy to clean, very durable, etc. So you can do a lot with solid surface in addressing issues. The question I get quite frequently, are solid surfaces antimicrobial? So there is a difference here. Microbes have a very difficult time attaching to solid surface material. It's also easy to clean. Antimicrobial typically means that there is a reagent or a product that has antimicrobial properties embedded in it. You always need to ask. There are solid surface companies that are saying that they're antimicrobial, that they are microbial resistant, not antimicrobial. The assumption is that antimicrobial products will clean themselves. Again, not true. So antimicrobial surfaces are not self-cleaning. I'm going to get up on a little soapbox here. All surfaces, whether or not they have antimicrobial reagents or products embedded in them, need to and are required to be cleaned and disinfected regularly. It is really frustrating when you go into a healthcare facility and the misunderstanding of what antimicrobial solutions or products actually can do. The people believe that they're cleaning themselves, and so the due diligence is not happening. Unfortunately, what happens is the antimicrobial agent oftentimes needs to be activated. So first you need to understand how that is. They're all different. The other thing is if it becomes covered with biofilm, what then happens is it becomes completely ineffective. So in reality, if we're not cleaning those surfaces as frequently as we are others, you are setting people up for failure and actually more microbes accumulating on surfaces. You get a false sense of security. So really you need to ask a lot of questions about antimicrobial. I'm going to show you a brief video here, and I just want to set this up really quickly. This video is research done by Harvard. It will show you how microbes mutate. Now, this is antibiotics that they are using. It is antibiotic resistant, but the same things happen with antimicrobial resistant materials. And so if you want to go ahead and show the video, you will have to push a button, I think, in the bottom.
So what we ended up building was basically a petri dish, except that it's 2 feet by 4 feet. And the way we set it up is that there are 9 bands, and at the base of each of these bands, we put a normal petri dish thick agar with different amounts of antibiotic. On the outside, there's no antibiotic. Just in from that, there's barely more than the E. coli can survive. Inside of that, there's 10 times as much, 100 times, and then finally the middle band has 1,000 times as much antibiotic. And then across the top of it, pour some thin agar that bacteria can move around in. The background is black because there's ink in it, and the bacteria appear as white. First, you see they spread in the area where there's no antibiotic, up until the point they can no longer survive. Then a mutant appears on the right. It's resistant to the antibiotic, it spreads, until it starts to compete with other mutants around it. When these mutants hit the next boundary, they too have to pause and develop new mutations to make it into 10 times as much antibiotic. And then you see the different mutants repeat this at 100. And after about 11 days, they finally make it into 1,000 times as much antibiotic as the wild type can survive. And so we can see by this process of accumulating successive mutations that bacteria, which are normally sensitive to an antibiotic, can evolve resistance to extremely high concentrations in a short period of time.
So I'm going to move forward with Granite and talk a little bit about, a lot of times people will specify Granite in the in a healthcare setting. It's natural, it's a beautiful color. Unfortunately, it was the underground aquifer for our water collection, and it is extremely porous and cannot be cleaned and disinfected. The solution to that would be moving to a quartz material, which again is a stone material or particulates, chips of stone that are embedded into a polymer base, which is non-porous. This material has a lot of beautiful qualities to it. I would not recommend it in a patient care area. However, in lobbies and some of those things, if you're looking for design, it looks like you, it has the look of stone, but you're able to then have the cleanability of the material. So a little bit more about quartz. It is, they're made of real stone. It's suspended in polymer. It creates a beautiful non-porous surface material. Seams still exist, but are minimal. And countertops can be cleaned, but you want to ask for testing data to verify. Before you specify, always validate. A healing environment isn't healing if it can't effectively be cleaned and disinfected. So testing and test methods. There are a lot of different test methods that exist. And so what can be used to clean and disinfect is the biggest question. There are EPA registered hospital grade disinfectants. You want to verify that the categories of disinfectants can be used for cleaning. You don't want a manufacturer to send a list of the disinfectants that you use in your healthcare or that are being used in the healthcare facility without verifying that they can be used on the surface materials. So review cleaning and disinfection requirements in the healthcare setting. There are guidelines. They are published. And oftentimes just by sitting down with your customer, you'll be able to ask questions. There are many different standard organizations that material manufacturers can select from for testing. There are no guidelines for testing and validating surface disinfection compatibility. So, and there is no standard for a test method for testing. Now, the Healthcare Surfaces Institute is developing a minimum standard test at this time. But you do want to test for real life. So asking those questions and verifying that they've done some testing. And this is an example of a test method. They actually took a 4x4 square sample of material, put it over a bowl, and then they poured a disinfectant material on top of it, let it sit for 24 hours, and then looked for a change in color. In reality, what they needed to do is look through a microscope to see if there were microbial reservoirs that had been formed that microbes may sit in. This is a test of a laminate material. On the left is the brand new laminate. On the right is laminate that was cleaned one time with a soft scrub disinfectant. And then you can see the little fissures and holes. And again, this is at a microscopic level where microbes can actually harbor, and it's difficult to clean those out. Manufacturer warnings, always ask about the manufacturer warnings. Typically a separate document, not always in the care and maintenance area, so make sure you ask. As I talked about, stainless steel has some issues. I have added, for instance, I put that here, the stainless steel precautions. Again, not part of the care and maintenance document. And what you really want to do is develop the trusted partnership. So architects and designers, there's a gap between understanding the design of an area and what's going to happen in real life. That's not the fault of the architects and designers, but what happens is the information and the situations, for instance, the needs for solutions, et cetera, we discovered by sitting down with infection prevention, facility managers, environmental services professional, and directors of nursing. And so as you develop these relationships, it's critical to have different conversations with them, so that you're able to specify and understand what is needed and what their challenges are. General contractors are another person you should have at the table. Many times they'll want to go and value engineer a project. And when they do that, they may remove products, which has been in our case many times, materials that were purposely put there by the healthcare professionals to help them address infection prevention protocol and processes. Food service areas also is an ideal location for solid surface. High traffic, high contamination, and so cleanability. You don't need to compromise design in order to address solutions in this issue. So let's quickly go through some checklists. And you can also get these checklists from Hyundai as well. Evaluate the location. Is it high traffic, high contamination? What are the cleaning and disinfection protocols and processes? Not necessarily the disinfectants that are being used, but what are the cleaning and disinfections protocol? And then what disinfectants are using? And ask about categories. There's only about 7 categories of disinfectants that are used when there's hundreds of disinfectants. How often will cleaning and disinfection take place? What is the expected life cycle of the materials or products that you are specifying. We've all been in situations where products have broken down and needed to be repaired and replaced. Do you have the scientific testing data? Again, validate the claims that are being made, evaluate the test methods that were used, what microbes were used in testing. Was UV and other no-touch technologies tested? Have all categories of hospital-grade disinfectants been reviewed? And review the instructions for use. Do they meet the needs of the healthcare setting? So an instruction for use may say, use 409 to clean this area. Well, hospitals don't use 409. So you want to evaluate, make sure the documents are accurate and pertinent. Whoops. And I would like to thank all of you for attending today. I am always available. I guess we're going to do some questions right now, but I am always reachable. And I highly recommend you reach out to your Hanex solid surface representatives and Hunstone. A great resource to be able to help you through with design and specification. Thank you.
Thank you, Linda. That was great. And we have a number of questions that have come in. Fortunately, we have some time to do some Q&A. One of the, there were a couple of questions regarding copper and its viability and where the sector is in terms of copper surfaces or integrating it into materials. Could you touch on that?
Absolutely. Copper is a great material. I recommend it for, instance, IV poles and things like that. The nuances with copper is, number one, it is antimicrobial. There is some research that exists now that is showing that microbes do build a resistance to the copper. I referenced Dr. Syed Sattar. And a lot of times, copper, the way that it's specified and used. So let's say a copper sink, for example. The microbe needs to get through the biofilm or even water to get to the copper ion before the microbe begins being destroyed. It's not destroyed immediately. So when you're specifying that material, what you want to do is be careful where you're specifying, how frequently it needs to be cleaned and disinfected, high traffic, high contamination. The disinfectants that are being used often, there are dwell times. So what happens is when the disinfectant is put on the copper, it actually oftentimes is not wiped off, and that renders it completely ineffective. So again, you really want to understand what are their disinfection protocols and processes, what are the materials that are being used. You want to make sure in training that the EVS team understands they need to wipe any coating off, including oil from fingertips. So on doorknobs, which is a great use of copper, you want to make sure that's cleaned off because that does inhibit its effectiveness.
Okay. We also had a number of questions regarding sustainability and how solid surface materials are regarded from a sustainability green products perspective.
What, do they have a specific question? That's a big subject.
Yeah, let's see. Well, I guess one of them was just like, is it considered a sustainable product? Was about as specific of the questions that we got regarding that.
So let's talk about sustainability. Couple of things here. Solid surface can be used multiple times. So let's put it in a high technology changeover area. Solid surface could be a countertop and then later used as shelves. So you're not disposing of it. There are some companies that are actually recycling the materials. There are some solid surface companies that will take the materials back and then they reuse it as particulate into other materials. So it really depends. So there's a lot of questions that you need to ask your solid surface manufacturer and then discuss with them how they can reuse the materials. I know one company that exists out there that is making cabinetry and things like that. they reuse the material. They will reconfigure. So the life cycle of the sheet or the product actually is extended far beyond the initial. So that's, I don't, those are the things I would talk about in sustainability.
Sure. I think that's very helpful. We had a few questions regarding cost. Specifically, one was cost often plays into what eventually gets installed. Can you share what percentage of increase in cost to implement the integrated design and use of solid surface materials versus traditional finishes?
Yes, great question. So solid surface material, number one, fabrication is where the cost typically is. So you want to partner with fabricators that have the ability to to solve problems in a healthcare setting. For instance, when we were doing the walls in healthcare, we often used materials that were very inexpensive. And we also developed partnerships with the hospital. So they were buying pallets of solid surface material, partnering with one of our fabricators that would do remodels and all of those types of things. And then they reused the materials to make, they were making plates to cover light switches. The hospital was. So we trained the hospital how to fabricate. We used materials. So for instance, the white materials or the beige materials in areas where the color didn't necessarily matter. And then we worked with our solid surface manufacturers to help with the design to solve a solution. So it's all about that partnership and how you can actually fabricate the material to get the look that the designer wants, but at the same time to solve problems. And so a lot of times, and that's where the disconnect always has been, is partnering with your solid surface manufacturer, discussing where you want to go with it, looking at cost-effective ways of doing that, and then partnering with the fabricators. So we actually had fabricators that we partnered with hospital facilities that actually did the work. And we also had hospital facilities. We did a whole wing of showers where they had a construction team or they had a contract with a construction company where we trained them how, they worked with our fabricators as well, but we trained them how to fabricate the material. And so they did the work themselves. So there are a lot of different cost-saving ways of doing this. And the way to learn about those is to work with your solid surface manufacturer.
Got it. That's great. One of the questions we had was going back to an example that you shared in the presentation where you talked about a coved floor transitioning to a solid surface wall. And one of our attendees wanted to know, what flooring did you use and what type of flooring did you use and how did you detail the transition point so that it was easy to clean? Kind of talking about that. Yeah.
Yeah, great question. It was terrazzo was the floor. This was an older hospital. That was the flooring that they had in place because we renovated and did the construction in this area. And what we did is worked with the flooring company to develop how to make that transition so that it worked. And so again, that goes back to the partnership with the other flooring manufacturer, the designer, and then the solid surface company and a fabricator that created the design that worked. Now we had to do some test runs of this. It wasn't just an overnight fix, but because there's a variety of different materials that you would be working with on flooring, but that team found a way to be able to do it effectively, and it worked. It was just fabulous. It was much easier to clean.
Okay. We had a couple questions too. Do you have a recommended thickness for wall surfaces?
It really depends. So we did an entire hallway, which was the emergency department leading to radiology. We used 1/2-inch material in that hallway based on the amount of traffic that took place. We started out with 1/4 inch in a small area, just tested it, and it took a lot of damage very quickly. So we advanced to, we went ahead and used the 1/2-inch material, and it was all seamless, and that held up much, much better. You will not be able to protect the walls from those portable x-ray carts because they'll go through stainless steel. But gurneys, a lot of the medical devices, those types of things. And then for cleanability, that was a fabulous solution. And when we did just that one test area, administration made the funds available for solid surface to line that high traffic hallway. And eventually we did a lot of other areas as well. Saved them a lot of money. So when we look at value of solid surface compared to the other materials, you also want to look at the costs, which is what we did for the hospital in constant repair and maintenance. And within 6 months, they had saved enough money to be able to use solid surface in the areas. Plus, they didn't have the infection prevention nightmare that they had before.
Right, right. I think we have time for one more question. And it seemed we had some questions that were kind of looking at, I guess, concerns about the materials and wanting to know if you could speak to, someone said in the past they've been concerned about using solid surface because of scratching, especially with dark colored surfaces. And then another question was regarding static discharge and if that's a concern with these types of products.
Interesting. I've never had the static discharge issue, and we were doing operating rooms. A lot of operating rooms have solid surface on their walls. So I've never had that. I've never had that issue. What was the first one? I'm sorry. What was the first one?
Somebody had said that they in the past had been kind of reluctant to use these materials for concern about scratching, especially if it was a dark colored solid surface.
Well, I never recommend, again, evaluating your location. I never recommend a solid surface dark color material just because it does show scratches, even though it doesn't necessarily is not dug in. So it can just be an etch across the top. But that's what happens with those materials. Using a particulate that is a little darker might be a better solution. As far as scratching, if you're not using a dark color, again, very, very minimal issue. We've used it in a lot of high traffic areas on surfaces. I'm just going to use an example of an operating room where we used it on the back, in the back area of the OR. A lot of materials and equipment and so on and so forth. We used it was more of a beige color material for them. And they didn't have to replace that for several years until they renovated it. It was over 5 years easily. And but we did recommend that they use a Scotch-Brite material. I'm not Scotch-Brite. One of those sponges with the scrub thing on them. And oftentimes, depending upon the amount of etching or scratching, we would go in with sandpaper. A fine grade sandpaper. It was just part of their ongoing maintenance, but it worked great. They loved it. They didn't have issues with the sinks and all of those types of things. And it allowed them to turn the rooms over faster. So that's saving money, actually.
Wonderful. Well, we're going to go ahead and wrap up. Before we go, I want to say many thanks to Linda for presenting and to Hyundai LNC USA for sponsoring this webinar today. It was great information. I know we had a lot of Q&A from the audience. So thank you to our audience for joining us and being engaged today as well. As a reminder, you'll have on-demand access to this webinar by simply using your registration link. It will be live in about 15 minutes. And if you have any technical questions regarding this event, please reach out to our producer, Skylar Little, at skylar.little@emeraldx.com. So I want to thank you all again and enjoy the rest of your day. Have a great day.
Thank you.